First of all, thanks for having this hearing. I think it's very much a New Hampshire tradition. My concern with the legislation has to do with the impact to the state government. This bill, as I see it, would be basically for health care as far as state governments and local governments what IDA is for education. There are huge impacts to the state government. I know Senator D'Alessandro is here, and it would add absolutely millions, if not tens and hundreds of millions, to state costs that will be put on by adding and expanding the Medicaid rolls, as well as dismantling the state's disproportionate share hospital program. This program would lead to, like I said, down the line, potentially by 2017, hundreds of millions of dollars in lost revenue or increased costs to the state of New Hampshire. How can you, as Congresswoman, assure us that will you pledge to vote against anything that would pass an unfunded mandate along to the states?
Well, let's address 2 points there. First of all, you talked about the states having to absorb the costs there. And the first bill that we worked on said that the federal government would do that. So, but it's been changed in another, because we're working on three different versions right now. And then what will happen is they'll all have to come together to do that.
There are 2 parts that would take the people who are currently in Medicaid,
Right,
currently eligible, and there's no new federal money for that, for those people.
Right, I understand how that works. So, but what I'm saying is that the federal government initially was to pick up the costs, and hopefully the federal government will be behind there. But the other part of it is that your guess about pushing millions and millions of dollars onto other people, I would have to dispute, because the intention here is to drive down the costs and to slow down the increase in costs that we're experiencing right now, and to make sure that we provide health care for those people who are showing up in these hospitals anyway, and you know that the states are picking it up. You talked about the disproportionate part, and what they're going to do is they're going to look and follow the numbers. Nobody will lose money. No hospital will lose money on the disproportionate service.
It doesn't go to the hospitals, it goes to the state.
Yeah, I know that, but what I'm saying is when they come in, it's based on how many people who do not have insurance in that region. And so that's how they figure out what the reimbursement is. And we've been discussing that in Congress. And we have people, and I too, do not want to see costs shoved onto the state, and I don't want to see hospitals have to continue to take people who do not have insurance and spread the cost to others. So we are addressing those. This bill is not complete, and I am paying very close attention to it. One of the committees that I joined to discuss this was the one to make sure, because New Hampshire provides actually excellent care, and they don't get the proper reimbursement for Medicare. And so I worked with the committee from people in rural areas as well, and said, this is not fair if we're not reimbursed properly. We have high outcomes, we have much better outcomes, and yet we have lower reimbursements. And so we did negotiate, and we're going to fix that. We negotiated with leadership. So you will see an improvement in that, and you will see that in the actual bill. And if you'd like, you can come up afterwards, and we'll make sure that we send that to the agreement that we worked out with leadership.